Hi, I'm Melissa Cady, the owner of Painless Wellness, and I'm a board-certified anesthesiologist and board-certified pain medicine physician. And I wanted to give you a play-by-play of what to expect for any type of breast procedure, whether I'm the one taking care of you as an anesthesiologist or another trusted assigned anesthesia colleague. So you'll be called from the surgery center, which is separate and apart from the surgeon's office and myself. You'll be called the day before or Friday before if it's a Monday procedure, and let you know what time to show up, usually about an hour to hour and a half in advance of the surgery time. Now, if you're going to be in the afternoon, there is always a potential that you get moved up in the day, so be very careful on when you stop eating and drinking. So preferably just nothing to eat the day of, and you can drink water up to 2 hours before. So I would probably venture to say maybe if you're an afternoon procedure for a breast procedure, just to go ahead and stop taking fluids or water maybe 3 hours before the proposed surgery time, just in case you get called in a little earlier. Now you'll show up to the surgery center, they'll call you back into the pre-op area once they're ready for you. They'll get you behind a curtain in one of the bays and they'll check your blood pressure and everything, verify the consent forms, and go ahead and have you change out of your clothes into a gown, and then they'll go ahead and start a small IV. That could be anywhere in the arm. That's typically anywhere the hand or the elbow. So once that's all set, one of the nurses from the operating room, which is called the circulating nurse, myself and or whoever's your assigned anesthesia provider, and the surgeon will come say hi. Once all of that is done and everything's verified, of course we ask similar questions on purpose just to make sure everything is accurate. Once we're ready to go back, we'll give you a little relaxing medicine, get you back to the room. Most of the time you don't remember getting to the room, or like a weird dream. That's pretty typical for this medicine that relaxes you. Once you're in the room, we get the monitors on, let you breathe some oxygen. Through the IV is how we get you to fall asleep. What continues to keep you asleep is what you breathe thereafter mixed with the oxygen. And typically for breast procedures that are less than 3 hours or so, usually a little airway device that just slips behind your tongue is something that is used. You won't know about it. It's just to keep your tongue out of the way when you're flat on your back. On occasion, on the longer procedures, especially if you have anything else in addition to a breast procedure, a regular breathing tube may be used, just depending on concerns for safety and whatnot. If that's placed, it's placed through the mouth between the vocal cords with a special instrument and placed carefully and gently, and that stays in place until everything is done. You'll be completely asleep. You won't be aware of the surgery. Your surgeon does an excellent job of putting a lot of numbing medicine along the rib cage area and along the soft tissues in most cases, and that'll help you out without needing a lot of long-acting opioids when it comes to the day of surgery, at least the earlier portion of the day. That numbing medicine will eventually wear off, and you might need to use some ibuprofen or Tylenol or whatever your surgeon has instructed you to use afterwards. Now, the anti-nausea medicine that we give is usually 3 or 4 different anti-nausea medicines. Most anesthesia providers will give 1 or 2. If you're given those typical 2, 95% of patients will be fine without any nausea. However, the 3 or 4 kind of take it up to that 99%, at least in my experience and our recovery of our patients. Whenever surgery is done, the anesthesia is just discontinued. You wake up within 10 to 30 minutes. Everyone's a little different, but most people within about an hour after a breast procedure are ready to go home. So highly suggest wearing something loose fitting or something you can zip up. It's easy to put on, take on and off, especially when you have a procedure done on the breast or chest area. The person picking you up will typically get updates after the surgery started, and then if it's a longer procedure, every 2 to 3 hours an update, and then eventually by the surgeon to let them know how things went, and then from the recovery nurse, usually within 30 minutes of when you're ready to depart or be discharged, they will go ahead and let that person know that you'll be ready to go and can give discharge instructions at the bedside. If there's any questions that came up along the way during this video or have any concerns, make sure to address that with your assigned anesthesia provider at the time of your anesthesia consult. Thank you.